Hey everybody. It's what is it? It would be Monday at about 4 o'clock, the 21st, and this is Dr. Tess on again. Good to see y'all. And I just wanted to do our fourth installment of Essure problems. So anybody that has any questions about Essure removals, questions about Essure, um, questions about the surgeries, the process of working things up. What should doctors be doing, or what questions should you ask? How can you get a copy of the Essure Patient's Bill of Rights that I have made up for y'all? What's going on in the in the world, in the country with the coils and proper removal? Just curious, popping on just to see if y'all had any questions today. So, let's see, what do I have going on? We're still pretty busy. There's still a lot of women coming from out of state, a lot of women still coming, obviously, from in state. We're seeing a lot more women that want to have just the tubes removed, and which is great if that's what you want to have done. The thing that makes me sad is still seeing so many women that are having to go to physicians that are local because of obviously transportation reasons and things of that nature, that they can't find somebody local to help them in the right way. And what I'm seeing is there's three ways that doctors are doing just coils and Essure tubes. One is what I call the cut and pull technique, where they're gonna cut the tube open and they're just gonna pull the coil out. If your doctor tells you that hey, this is easy, I can do that, that's not a problem, chances are that's probably what they're going to do, which is why I always tell you to draw a picture. I have seen so many women that have had the cut and pull technique, it's not even funny. And while probably a lot of them, the coil comes out intact, in many of them it doesn't. And you just don't want to have pieces, because once they turn into pieces, then it gets to be super hard getting those things out. So you want it done right the first time, obviously. Lori just joined. Hey, Lori, how's it going? If you also have any hormone questions today, by all means, please feel free to ask about your periods, hot flashes, mood swings, irritability. Pretty much sounds like Monday right there, huh? So let's see if we have any questions. I know there's 6 people live right now, so let's throw it to questions. Oh, number 2, sorry. We got number 1 was cut and pull. Number 2 is where the doctor will go where the uterus connects to the tube, and they just cauterize it and then cut it straight off. The problem with that is if the coil is properly placed and it's a grade 2 insertion, meaning there's probably 1/3 of it in the uterus and 2/3 in the tube, then they're going to cut right through that coil, and you're going to have either coil exposed, or you're going to have issues where you're going to have a piece left behind. So I wouldn't recommend that as an option either. I would think that it would be good for you to have the technique where we core into the uterus. Currently, the only people that I know that are doing that right now are me and Ed Durone in Atlanta. I think he also works in California. Obviously, I'm biased, but I think that's the best way to do it. And it's not easy, and it's probably harder to do that than a hysterectomy. But if the doctor offers you a hysterectomy and they don't know how to do a proper salpingectomy, then I would take it. So Sean Kelly just joined. Hey lady, how's it going? She's in love with me, but we won't tell anybody that. No, she's a good friend. And so what we do, or what we're going to do today, we're just going to open it up to Essure questions, hormone questions. Let's throw in some fun stuff too. If you have any nutrition questions, I'm going to tell you, I've been doing this ketosis thing now for 6 weeks, where I've kept my carbs less than 20 grams a day, and I've lost 17 pounds. And I'm still going strong. It's actually wasn't that hard, although I do love carbs. I like my bread and my pastas and stuff like that. So that was a little bit difficult, but it's really been hard more than anything was the fruits. Just not eating very much fruit because it has a lot of fructose. So if you want to ask questions about diet, nutrition, Essure, hormones, any sort of questions like that. Otherwise, I'm just gonna start talking. I already talked about Esher removals. Where we are right now is, like I said, I'm starting to see. Thanks, Jenny. She's on my payroll, so she's got to say that. So what we're seeing though with the removals, like I said, it's not so much hard now finding doctors that will probably help you. It's hard finding a doctor that will do it the right way. And I know that I catch a little flack about that. I'm not trying to be egocentric or to tell you that I'm the only one that knows how to do it. But I will tell you that because I've done about 400 of these now, I'm starting to see disaster cases coming from around the country. I just saw a lady that had a hysterectomy that has 1.5 coils left. And so, and she had the hysterectomy to have the coils removed. So what you have a lot of doctors still that may want to help. They may not know how to. You may have doctors that want to help and think they know how to, but they don't really have the respect for the coils causing problems that I think they should. And because there isn't a respect there, then they are liable to remove things kind of in a way that they think is fine, and they may think, well, if I leave a piece behind, it's really not a big deal. So that's why I kind of stress going to somebody that not only has done a bunch, but that also has a respect for the coils. And I wouldn't go to somebody that's still putting them in, because I don't think that if they're putting them in, they obviously respect the fact that there could be problems, or else they might not be putting them in. So that being said, last week or a week and a half ago, we talked about estrogen dominance, which is something I see a lot with the coils. Something else I see a lot with these coils is testosterone deficiency. And probably 9 out of 10 women that come to the office, their testosterone isn't just low, it's like off the charts low. And that's 25 to 55 across the board. And, this is fairly common in society at large. Even with men now, testosterone levels seem to be reduced. And I think it's mostly because we have problems with obesity, we have problems with sleeping, nobody's sleeping, people are drinking more alcohol. But I also think that there's a possibility that the Esher coils add to that, because they have an endocrine disrupting capability. The polyethyl terephthalate, nickel, aluminum, stainless steel, all those things potentially can interrupt the communication between your brain and your ovaries. And your ovaries make about 50% of your body's testosterone, with your adrenal glands making the other 50%. Also, if you, one thing I guess you could say that fat might be good for is it does aromatize some of your body's estrogen into testosterone. The problem is when you're estrogen dominant, which is the first endocrine problem that I see, especially in women with Esher, but in most patients. When you're estrogen dominant, meaning your estrogen is through the roof, then what happens is your body makes a hormone called sex hormone binding globulin, which floats around in your bloodstream and grabs onto your testosterone, making it inactive. So the more overweight you are, the more estrogen you're making, the more that your testosterone is actually going to decrease. So a way to raise your testosterone is obviously one, you could take testosterone, but you could lose weight. Easier said than done. But that's why I brought up the ketosis, because there's a lot of controversy about like how you should eat. Protein, animal protein versus vegan. There's this raging thing. I say that you have to do what's right for you. And for me, I think that if I eat super low carb, my body responds a lot better to that than if I eat a ton of carbs. And, that's just my body style, my body make. But it might not be yours. You might do better with higher carbohydrate intake. And really the only way to know that is to start doing it and figure out what works for you. Obviously, the best way to lose weight is with something that you're going to continue on. And really, if you're going to do something that's full throttle, like the beta HCG diet, where you're eating 500 calories or less a day, you're not gonna sustain that. And so chances are you're just gonna rebound and you're gonna gain all that weight back. So Esher, properly removed, it can also cause hormone disruption, most commonly estrogen dominance, secondarily testosterone deficiency. Now, I call the testosterone deficiency archetype that I see is called the nun. N-U-N, not nunya, but nun. And I don't mean that in a bad way. I grew up with nuns because I did catechism and everything. Um, Catholic college, Catholic medical school. So if you're the nun archetype, the good nuns don't have sex, right? So women that are nuns, archetypally, energetically, don't have much of a libido. They have a decreased libido. Um, they may dress themselves kind of in a frock or a schmuck because they don't feel good about themselves. It's not a negative thing to be the nun. It's not a negative thing to be any particular archetype, because there's positives to every archetype too, because nuns are very loyal, they're very intelligent, they're very dedicated, but they do have this aspect of their lives that is libido is not a part of their lives. And for women that aren't really nuns in real life, that's a problem. And it can change relationships. It can change just, how you feel about yourself. Testosterone is a feel-good hormone. And so with the Escher coils, most of the time I will see estrogen levels that are super high, and those super high estrogen levels can then drive down testosterone levels. So a lot of women that have the coils also have a decreased libido. And that goes hand in hand too with some of the times, if you have a 20 to 30 pound weight gain with these coils and you may not feel particularly good about yourself, you're not really sexually interested. So there's a lot that goes on here, or that could go on here with, weight gain, hormone imbalances. And, we kind of overlook that. We look with Escher removals, we look to pain, irregular bleeding, things like, dyspareunia or pain with intercourse, but we forget about the secondary aspects where we have hormonal imbalances, and that can cause problems. And I will tell you, I say we, obviously I don't have Escher, but what I say we, I mean the 1,000 women that I've spoken to with this problem, the tens of thousands of women with hormone disorders that I've spoken to. And really, when I repeat things, it's not something that you learn always in medical school or residency, but over the last 15 to 18 years, I've learned this from y'all. So this is just me telling you what I see, what I hear, and what works and what makes things better over time. We may not have an immediate fix, but sometimes just adding testosterone to your add-back therapy as a hormone is all you need. Sometimes we have to use supplementation. Sometimes we need to change your nutrition like we talked about, or exercise plans, things of that nature. So there's lots of things that we can do to change that. So does anybody on right now have a question about Escher removal, hormone imbalance, any type of, female problems that you might have, like heavy bleeding or hot flashes, mood swings? My mom was horrible with Escher. Well, don't tell her that, because she doesn't need to know that. Hopefully she got it out now, though. Yeah, but I hear that all the time. Do you do a uterine resection, or do you perform uterine resection or ablation on a patient if they're having typical irregular bleeding and effects of ablation with Escher? So here's the problem that I see with ablation, and I see this a lot. Women that have heavy menstrual bleeding, or what we call menorrhagia. Menorrhagia is just heavy regular bleeding. Metrorrhagia is heavy irregular bleeding. But sometimes women with abnormal bleeding will also have pain when they have their cycle. So if you have increased pain with your cycle, even if you have increased pain in general, I personally wouldn't recommend an ablation, only because what happens with the ablation is it heats up the lining of the uterus, right? So it basically cauterizes the inside. Well, in a lot of women that have pain, they have a problem called adenomyosis, Adenomyosis. And what that means is instead of the lining just staying on the inside, you have roots that grow down into the muscle wall itself. So when you have a period, you bleed also deep into the muscle and not just out. So when you put that heating device up in there and you cauterize the lining of that uterus, over time, that scar is going to close off, right? It's going to close off the inside, but you're still going to be bleeding into the muscle, which over time can cause the uterus to be heavy and painful. It's kind of like, I use this analogy. If you came to my office for 5 days in a row and every day I hit you in the arm, which would be kind of like having your cycle. After about 6 or 7 months of that, not only would you be painful all the time, but when you came in and I punched you, it would be extra sensitive. And that's kind of what adenomyosis is. So with adenomyosis, you got to remove the muscle. The problem with adenomyosis is that you can't see it necessarily with an ultrasound. And it's a diagnosis that we make more after the uterus is removed with a microscope. So usually women that have adenomyosis have great responses to either hormone therapy or hysterectomy. So I guess that was a long-winded answer to your question. Any other questions? Essure removal, hormones, hormone imbalances, heavy bleeding, Excessa for fibroids, anything. What kind of car I drive. I mean, whatever you guys want to know. I'm an open book. I have nothing to hide. Anything at all. There's 15 people live. Now, I would tell you, if you're not seeing this live, go ahead and leave a comment, because I come back and look at all the comments later on, and I'll answer whichever ones I can, probably in the next day or two. Could you go over prior imaging? You talking about for essure removal? I'm assuming. So the number one test that's going to be performed in offices for essure removal is going to be an ultrasound, right? Ultrasound is okay. It might see the coils, it might not. Back at my old office, I was reading about 600 ultrasounds a month. And so I'm pretty learned in how to read a scan. And they're not necessarily easy to read. I get an x-ray of the pelvis, and I get you could get an HSG, but I just do an x-ray. So I would say, Juanita, if you are hearing about a lot of botched surgeries, there's a couple of things you can do. When I do the surgery, I'm looking for the coils in the specimen when I take it out in the OR. If I don't think I got them, then I do imaging in the OR to remove those. Angela, is there any imaging that can be done prior to removal? Yeah, I think I just answered that. The problem is, Angela, if you want to have your just your tubes removed, you probably need, if you aren't going with somebody that's done a lot of these, you probably want to have something that is, you probably want to have somebody do an HSG. With the coil removals, I still get just the x-ray, but most of the time I'll do an x-ray during the procedure when I'm done, while you're still asleep, so I know that they're gone. Jennifer, did you hear my answer to your questions, or are we having technical difficulties? I had essure put in, had the ablation at the same time, had a hysterectomy in 2016, and then had growing, it was removed. Now I have to worry about autoimmune because why? I didn't get the rest of that. I have seen women with autoimmune disorders that have essure, obviously, and I've seen a lot of those women get better. There is some evidence right now of a new treatment for autoimmune disorders called low-dose naltrexone. And naltrexone is a medicine that we use to reverse opioid toxicity in patients that might overdose. That dose is about 10 times the dose that we use for low-dose naltrexone. It's a compounded medicine. It's fairly new. It's off-label. It's not something that probably you're going to see every doctor wanting to prescribe. I am in San Diego. I'm there all the time. I was just there 2 weeks ago, and I'm coming in October. I should do surgery out there, though. I had a friend who recently had a hysterectomy and her ovaries removed. She's having terrible gyno symptoms, and her doctor won't give her hormones because of family history cancer. That's ridiculous. One, it's either a male doctor that doesn't have any idea what it's like to be a woman, or two, it's a female doctor that's just mean. What I would say is, if this is somebody that knows you as a physician, like you've seen me a bunch of times, we have a relationship. I would assume we would have a relationship if we did a hysterectomy on you. Just because you have a family history of cancer doesn't mean that you're going to get cancer, right? And it doesn't mean that you need to suffer. If she is suffering, if she is miserable, if she can't live her life the way that she wants to, then why would we refuse to give her hormones? It doesn't make any sense to me. I wish that doctors weren't so black and white, you know? I understand and I get why they're saying that, because obviously they don't want to contribute to cancer, but estrogen doesn't cause breast cancer, because if it caused it, every woman and man for that matter would get breast cancer. Now, it might potentiate estrogen receptor positive cancers, and in some women that have too much estrogen, it could certainly stimulate a cancer cell, but it doesn't necessarily cause cancer. Cancer comes from DNA damage over time, oxidative stress, what we eat, what the air that we breathe in, drinking too much, breast cancer, not breastfeeding, early age at menarche, old age at menopause. There's so many things that can contribute to breast cancer. Estrogen is only one of those things. So are you going to suffer? Are you going to walk to the grocery store because you might get into a car accident? No. And the chances of getting breast cancer are less by taking estrogen than getting into an accident going to the grocery store. I think it's just, you know, I'm not trying to take it lightly. I'm very serious about it, obviously. My mom had cancer herself, and my wife's mom died of breast cancer. So I'm very sensitive to that. But I'm also, sometimes we throw the baby out with the bathwater, you know? And I don't think it's right on both sides. I think there's the side that won't prescribe it no matter what, and then there's the side that says, oh, you know, we can cure breast cancer with estrogen. Neither of those are good. We have to stay in the middle. You know, we have to be able to be reasonable about these things. Yes, she's very miserable. You know, she can call Jenny at 512-956-0296, and I can definitely have a discussion with her and get her family history. And usually the increased risks of breast cancer are going to be if you have two family members out to 2 degrees, so mother, grandmother, or sisters or aunts, that have had breast cancer that were younger than 50, or multiple women that have breast cancer that were older than 50. Any woman that's had a family history of colon cancer, although the WHI study that scared every woman out of her brains about estrogen showed that there was a decrease in colon cancers by 50% in the trial, and you don't really hear much about that. The other thing you want to look at is a history of ovarian cancers. Now, breast, ovarian, colon can travel in families. And so if you do have a family history, we can always get genetic testing now for BRCA1, BRCA2. So that's important to know. I'm having a thyroid problem since removal. I was on 100 of Levo. Now my hair's still falling out, weight gain. I would say if you haven't had your thyroid checked in the last 6 weeks or so, you probably want to get a full thyroid panel, and not just a TSH, but a free T3, free T4. I would recommend the book by Isabella Wentz, W-E-N-T-Z, called Hashimoto's Protocol, or her other book called Root Cause. Isabella is probably one of the foremost authorities on thyroid issues in the country. Her book, Hashimoto's Thyroiditis, just was a New York Times bestseller. So I really think it's a good one, and something that you should read if you are having thyroid problems. Well, we're up to 31 people. This is a record for me. So let's ask some more questions. Issue removal, hormones, hormone imbalances, surgeries, Excessa for fibroids, which is the least invasive procedure you can do, where we take a little teeny needle and we poke it into the fibroid through laparoscopy, and it melts the fibroid from the inside, so you don't have to do myomectomies, hysterectomies, and things of that nature. Especially important for women that don't want a hysterectomy or that don't want to have major surgery. So that's an option too. How soon after surgery is the HSG done? Are you talking about when you get the Essure? If you get the Essure, the HSG should be done in 3 months. That's the recommendations from the manufacturer and from the FDA. The problem is many women don't get it done. One, women on Medicaid get terminated by Medicaid before they can get the test done. So Medicaid will pay to put it in, but then they won't pay for the test, which sucks. And then women with private insurance, you get busy, right? I mean, it'll be covered, but who wants to go have it done? So no HSG done. Wanted to know how soon surgery. Oh, you're saying you want them removed? I don't need you to get an HSG. I would need you to get an X-ray so I could locate the coils. Just because I want to know, one, how many you have. I've been surprised. I've had women, I've seen 5 coils, and I'm not talking about 5 coils inside the uterus. I'm talking 5 coils in the body. I've seen coils where they're not supposed to be up by the stomach, embedded in fat. So if it's being sent, I'll take a look at it. And then we should probably be able to get things scheduled within a week or 2. I mean, Leslie should be calling you. My doctor won't listen to me. I've got serious problems going on, like the numbness, headaches, severe bloating, joint pain, break vomit. What do I do? Where do you live? Do you live in a really cool state like Texas? Or do you live somewhere that's not as cool as Texas? I had HST done August 31st last year. Didn't realize should have surgery done soon after. No, you don't have to have it done soon, Jen. That's fine. You're okay. Let me answer this other question. What should I do with all those symptoms that she's having? This is a tough question because if you can't find anybody to help you, I don't know what to do about that. No, Dr. Sales won't need to. Sales he's almost as good as me, right? No, he's actually a great guy. Sales is probably one of the best, and I would totally trust whatever he says. So if you can't get help, call me. I'll see what I can do. We can try to find people. You can have your doctor go to www.removemyesure.com, and they can take my course, which I can show them how to do it online. They don't even need to come out here. I want to take this out. What insurance do you take? Basically, we take them all. Some of the smaller ones like Ambetter and Multiplan PHCS I'm actually credentialing with right now. All of the major plans we take, and the hospital I work at also does a cash deal that's fairly cheap compared to most other places. Do I know any doctor in Ohio? I have heard of a guy in Ohio named Aurora. I don't know what town he's in. I think his name is Arora. And I know that he's done a bunch. I don't know the exact technique that he does, but being on the Ohio board, I've seen a lot of women. You should join the eSure page for the Ohio ladies, and that would definitely give you more resources because they can guide you in that direction. Do I start feeling better? What surgery did you have done, Ethel? I had eSure done, and now it seems like I'm having a lot of immune problems. Is this common? Is it common in the sense that a lot of people get it? No. Does it happen to some women that they have autoimmune disorders and they have the eSure removed and they don't get completely better? Yes. I mean, I've had ladies that had really bad rheumatoid arthritis, removed the eSures, and she went down from 5 medications to 2 medications, so she got better. But the autoimmune disorder did linger. And so the question is, does the eSure, which came first, the chicken or the egg? I don't think there's any way to prove that eSure causes autoimmune disorders, but we seriously are seeing a lot of women that do have that issue. So it's definitely something that we are concerned about. I don't know if there's any studies being done on that right now, but I have seen autoimmune disorders get better with that. It's just whether or not they're going to go completely away. How about Wisconsin? Sorry, Tara, don't know anybody in Wisconsin. Somebody posted Aurora stuff. Hey, man, don't be posting other doctor stuff on my Facebook Live page. I'm kidding. No, Aurora's, from what I hear, he's really good. I can't wait. Well, Misty, we're going to take him out, right? So, yeah, you don't have to wait. We'll probably get these things out in September. Cash deal. The office number is 512-956. I don't ever call it 0596. I think Jenny just posted it. The cash deal the hospital has is they charge about $5,100 for the surgery. I charge about $1,800 and then anesthesia. So it's going to come out to somewhere around $7,000 to $8,000. They haven't done an X-ray or anything. Keeps it ultrasound. Okay. Ovaries are fine, but I'm in extreme pain. Most days they said the Esher isn't. Well, here's a problem, Tiffany. Did you have the pain before you had the Esher? If the answer is no, and you have serious pain now, then where the hell else did it come from? Right? Okay. So to say that it's not causing you pain is ridiculous. If we put these, I've said this before and I'll say it again. If we put these things in a guy's testicle and he came in and he said, Doc, these things are killing me, and the doctor could go up and touch them and they hurt, he'd take them out. But because women, we can't touch your fallopian tubes, we say that they don't hurt. Well, why can't they hurt? Even the manufacturer says 2.9% of the time they cause severe pain. 2.9%. That's their own studies. That's the pilot study that was done. So they even say that it can cause severe pain. That's severe pain. That's not mild to moderate. That's severe. So if the manufacturer even says that, then why would the doctor say it doesn't? What insurance do I take? Like I said, I take most. If you have a specific insurance, call Jenny and ask her. Bear admitted that it caused Esher. I need to see that. I don't remember that. So I didn't see that. All right, we got 48 ladies. I am on a freaking high right now because this is like a record for me. What is the downtime with my procedure? 1 to 2 weeks. It depends on your job. It depends on how rigorous it is, how physical it is. But it's a go home the same day surgery to just remove the tubes and coils. So usually 1 to 2 weeks. 1 week you'd be pushing it, but if it's a desk job, you probably can do that. I have a fragment attached to my uterus. How do you know? I don't want to call you Chub, but that's what your name says. So Chub, how do you know that you have a fragment attached to your uterus? You can't tell that on an X-ray and ultrasound. You'd need to actually see that by laparoscopy. So somebody need to be in there with a camera and actually see that fragment stuck to the uterus. It's kind of hard to tell otherwise. I mean, we're still going strong here. Let's see. Jenny's going to tell me I need to quit pretty soon because she doesn't like it when I ramble on. But I'm going to throw it out there. Esher removal. Questions about Esher. Hormones. Hormone imbalances. Any other female problems. Painful intercourse. Stress incontinence. That's a big one. See that all the time. Do I need to have a hysterectomy to have the coils removed? No, you don't. But if you're not going to have babies anymore and you know with 100% assurity that you never want babies again, it probably isn't a bad idea to do a hysterectomy simply because you can guarantee that the coils come out and they're not going to be fractured. I'm sorry, I'm trying to read. Ultrasounds, yes. Chub, if that's your name, I will tell you, because I do ultrasounds all the time. Now what they might have meant is that there's a piece of the coil inside the uterus, which you can tell on the ultrasound, and that is supposed to be there because a part of that coil is supposed to be anchored inside the uterus. But to tell you that there's a piece of coil attached to your uterus on the outside, no, there's absolutely no way they could tell that with an ultrasound. 45. I'm not going away. I'm not going away until the number of live people drops below 20. Then I'll cut it, because if there's that many people on, that means that there's questions out there. So I saw Angie Dessa was on here earlier. Welcome, Angela. If you do a hysterectomy, can you keep the ovaries? Definitely. And actually, in somebody that's 25 to 40, I would probably recommend that you do so. They know how much hormones to make. They're going to be working until you're 50 to 51. Somebody that's over 40 that's a personal question. That's a hard question to answer. I would say most women these days want to keep their ovaries, and that's perfectly fine. They will help you maintain your hormone levels, and if you don't need to have them removed, then don't have them removed. I can't see that whole question, Misty. Is there a cost difference between the surgeries? Actually, it's interesting. I had two sisters come from Nebraska about 6 weeks ago, and one had a hysterectomy and the other had the tubes and coils removed, and I think the cost was exactly the same. So if that answers your question, it's kind of silly that one would cost more or they'd be the same, because you would think the hysterectomy would be a little bit more of a surgery, but time wise is kind of how they measure things, and the time it takes to actually remove the coils from the uterus is about as long as it takes me to do a proper tubal removal. My x-ray did not show my Essure. Well, that's not good. If they did a whole body x-ray from your diaphragm down to your pelvis, then it's not there. I have seen that occasionally. We don't know why they fall out, but they fall out. What is Essure? Essure is a permanent sterilization device that is a little coil, and you can look on the internet and find pictures of it. And it was made to sterilize women without an abdominal incision. So it's something that was done in the office, is done in the office, and I think a lot of us wanted to do this procedure because it did involve less cutting. But we are seeing a population of women that are having complications from it. So, but it's still a procedure that is being performed in offices around the country. So, my doctor, I don't know why, Jenny, I can't see the whole picture. Something's getting pinned here, and I'm not able to see the whole, I can just see it one sentence. My doctor who did my histo did blood work on me, and then I can't read the rest of it. I was able to read the rest of it earlier. I'm wondering why it's pinning. I'm getting oh, there we go, got rid of it. Whew. My doctor did my histo blood work on me 48 hours after removal and did my blood work. My blood work improved greatly. She's convinced the Essure. I don't know what your blood work did or what the improvement was, but that's cool. Side effects from having tubes removed. It's a controversial topic. Most doctors will tell you nothing. There are some topics that, there are some doctors, some people, there's a Facebook page for post-tubal ligation syndrome, and they think that by removing the tubes it can affect the blood flow to the ovaries that can cause problems with hormone imbalances and periods. My take on it is that it probably makes you feel better, and that technically if you're not wanting to get pregnant, then there wouldn't be much in the way of complications from having your tubes removed. I'm 35 weeks pregnant right now because of one of my coils fell out. I'm actually surprised I made it this far. I want both tubes out so I don't have Essure and I don't get pregnant. Well, that makes a lot of sense. You're going to have to wait until after you have your baby. Congratulations. I know it was probably unexpected, but 35 weeks in, you're almost there. If you're having a C-section, they should not even attempt to remove them at the time of C-section. I would wait until about 8 weeks after you deliver your baby and then consider having them out. What would be next if my x-ray and sonogram did not show my Essure? For women that have Essure that can't find it on an x-ray, make sure you didn't have a procedure called Adiana, which is A-D-I-A-N-A, Adiana. Adiana was promoted as Essure, but it's not Essure. There was no implant that was ever inserted, and it doesn't show up on any x-rays. I've had that happen twice, where I got the operative note and they actually had Adiana. Which is better, having tubes or removed or just the Essure taken out? I would never recommend just having the Essure taken out, ever. I would take the tubes. So many women getting UTIs after surgery. I've done 400 of these, and I've maybe had less than 5 UTIs. 1%, I think that's pretty normal. It's usually because of the Foley catheter. We do give a dose of antibiotics prior to the surgery in the IV. But really, I don't think that that's something that if you hear a lot, it's just because I think you're getting a biased population. You're seeing a lot of women that have surgery, and so you think that they all have UTIs. Should Essure be removed not having any serious side effects? I tell women all the time because I get asked this question a lot. If you're not having any problems at all that you know of, then don't have surgery. It's not worth the risks. What do you do to combat side effects? It depends on what the side effects are. If it's pain, there may not be a whole lot you can do. Short of pain medications, maybe working with a pelvic floor physical therapist, trying whatever you can. Bleeding, the only things that I can think of to help with bleeding would be hormonal control. I'm located in Austin, Texas. Woohoo! And it's about 100 degrees, 103 degrees, and very humid. So if you're going to have these done and you want to come from out of town, wait until probably October or November when the weather's really nice. I'm already booking into October, but I might be able to get people on Wednesday afternoons. I'm probably about a month out on surgeries, so I have 2 coils in 1 tube. Is there a specific surgery I should have done? I would definitely recommend having a surgeon that knows exactly how to deal with these. I wouldn't go to somebody that's just toying around, that never done these before, because you need to have the coils removed appropriately, properly, and then you need to probably have an x-ray while you're still in the operating room to make sure that they're gone. How do I take them out? I'll free the tubes up from the structures that hold them in place, and then I do what I call a coring technique, where I'll core into the uterus around the coil till I get down inside the endometrium or the cavity, and then I'll take everything out in one piece. I also do that. I do that surgery no matter what, because I think as the coil goes in the tube, even if it's way out on the end, it's dragging all those PET fibers, and those PET fibers could be what's causing problems. You said you wouldn't have just the Essure remove and leave the tubes. Is that why they do for reverse? Technically, I'm not a fan of reversals with Essure, but I know Monteith does them in North Carolina, and if anybody was going to have them done, I'd probably have them see him. But I don't even think Monteith does that. I think Monteith cuts out the coil and the tube, and then whatever piece of tube is left on the end, he reinserts it back into the uterus. So you may look like a little T-Rex, but I don't think he just pulls the coil out. What is the incision? The incisions are, so it's laparoscopic. The incisions are very small. They are 8 millimeters, meaning probably that big. And there's either 3 or 4 of them, so very small incisions. How likely is it to prolapse if you have your tubes removed? No more likely than if you didn't have them removed. Recovery is different. Hysterectomy is probably 2 to 4 weeks. I know some folks would argue that. I'm not saying that's a relative answer, depending on your job, depending on how you recover, depending on what else is in there, like scar tissue, the length of the surgery. Everybody's a little bit different. Some people just bounce back a lot faster. So hysterectomy 2 to 4 weeks, just tubes and coils, probably 1 to 2 weeks, somewhere around there. I have the Essure. Uterus is the size of 4 month pregnancy, laparoscopic surgery. Question, I have tons of symptoms. Yes, you can still have laparoscopic surgery. It's harder just because we don't want to cut the uterus up into pieces, because we don't want to cut the coils, but it's still possible. Insurance, like I said before, I take most of the majors. I take Medicaid. I take Medicare. I'm getting on PHCS and Ambetter. The only insurances that I don't take would be insurances that are local to where you are. So like if it's a county-based Medicaid, if it's Kaiser, something like that, I wouldn't obviously take those. Anything else? We got some good questions. I'm up to 57 people. I'm hoping they're all women. Maybe there's some guys on there. OBGYN said I need to see an allergist. Positive for male. That's ridiculous. Find a different doctor. I have my surgery scheduled. However, I'll be in the middle of my monthly cycle. Should I reschedule? No, I don't see any reason why you should have to reschedule that. I mean, it's purely up to you, but it doesn't bother the surgeon at all. What else? Up to 58 is a new record. I'm here. Questions, comments, diet, nutrition, Esher, hormones. Seems to be dominated by Eshers right now. Keep throwing me those likes. Maybe some hearts. Let me see the hearts. I don't get many of those. I get a lot of these. But I don't get a lot of hearts. I just want to see the screen filled with hearts. And then I can show my wife later. Oh, here we go. See, she's going to love that. Oh, yeah, see? Yeah. Now she's going to go, you just asked for it. I'm like, no, see these? Yeah. Tons of hearts. Woo-hoo, ha-ha. I'm going to show my wife this. And boy, oh boy, she's going to love it. Thank you so much. And all I had to do was ask, see? I'm asking for the compliments. But no, really. I will tell you this. I put Eshers in for many years. I stopped putting them in about 4 years ago. And I wouldn't keep taking them out if I wasn't seeing a lot of women get better. The results I'm seeing are fantastic. I love seeing it because obviously it makes me happy that I'm able to make that difference. And this is probably one of the first times in my career where I've actually felt like I'm making a big difference. And so I wasn't looking for this. I fell into it, and it's really important to me. And I just want to make sure that every one of you out there has the ability to have these things removed the way you want them. Oh, I wasn't getting these questions. Does anyone, don't know anybody in Nashville, sorry. I'm located in Austin, Texas. Jenny, what is 60? Does that mean I got 60 hearts? I don't recommend reversals. One, I don't do them, but two, I don't recommend them because the way I look at it is Esher causes damage to the tube. It basically destroys the tube, right? That's how it works. So why would you take it out and then put the tube back together if it's damaged? Now, you need to talk to Monteith because he does have success rates. I don't know his numbers. I think he's around 30%. But it's about $8,000, give or take, plus travel. And I would say, if it was my money, I would just have them removed and do IVF, which is more expensive. But that's just me. Filthy clips, I take those out too. 48, is it realistic to leave my ovaries? Sure, it's realistic for you to leave your ovaries. It's totally up to you. My mom died of ovarian cancer when she was 56. And so I'm a little biased about leaving ovaries in. But I tell everybody that because I know that had my mom had her ovary removed, she probably would still be alive. At least I'm assuming she would be. But you never know, you know what I mean? But it's really up to you. That's a very personal choice. Why does it cause so much trouble? I don't know. I wish I did, but I don't. I just had my surgery last Tuesday. Only tubal stomach hurts. Is bloated. Is that normal? Yes, bloating is usually normal after surgery, but I would call your doctor. Thank you for stopping. I need recommendations for the Milwaukee, Wisconsin area. I don't know anybody right now. I'm looking for doctors that want to do it the right way, and I'm hoping to train some, but right now I don't know anybody in Milwaukee. Well, go find Jen. Look for Aurora. See if you can go see him. You're welcome. Pittsburgh. Actually, no, Maria. Don't know anybody in Pittsburgh. I will say that I've had 2 people from Pittsburgh come to Austin, and I've done their surgeries. Is the surgery outpatient? It's less than 23-hour observation admission for a hysterectomy. The tubes and coils is an outpatient surgery. Angela, thank you very much. We are up to 61. That's a new record. I mean, that's so cool. It's great. Is stress incontinence caused by inflammation? Usually stress incontinence is caused by an anatomical change, meaning babies, genetics, things like that. Why do you need your reproductive organs? Well, because you were born with them, and the uterus does have some support structures that help the vagina Obviously, your ovaries are important. The uterus, though, realistically, all it does is have babies. But, you know, if you don't need them taken out, why have surgery? Why didn't docs tell you? Honestly, I got to protect the docs here because we tell you what we know. We consent you how we were told to consent. I truly believe. I don't think that there's doctors out there, honestly, that want to hurt people, or they would be serial killers and not doctors. I do think that, you know, sometimes we don't always make the best choices, but we tend to try to make the choices as best we can. Ladies, where's Dr. Aurora? There he is, Westerville, wherever that is. I don't know in Cincinnati where you can go, but Aurora might be able to tell you somebody in Cincinnati. And I don't know how far away from Westerville that is. What else? Any other questions? We're up to 63. This is amazing. Anything else? Okay, before we go, I got to ask one more time. Just let's do a bunch of hearts because I'm feeling it. I'm feeling the hearts. I'm feeling the love. Jessica, sorry if you didn't answer. Is it normal to get a cyst bleeding internally over the... Well, if you still have your ovaries, Jessica, yeah, you can still have bleeding ovarian cysts. Keep them coming. Keep them coming. Let's flood the screen. Let's do it. Let's flood it. I can't do hearts. I can't give myself hearts. That wouldn't be appropriate. So, hysteroscopy, laparoscopy with removal of certain tubes, 2 weeks post-op. When do I begin to stop hurting? Ethel, you need to call your doctor to find that out. Thank you. Keep them coming. Let's go. Just push, like, really do that really fast thing, you know. Yeah, that's what I'm talking about. See, that's when you have to buy your compliments. When you ask for it, you're buying your compliments. And I'm not, you know, I'm not above that. I'm a normal man. So, right? I mean, I need to be told I'm great. I'm just kidding. One thing that I like to do, and those of you that have seen me, is I like to keep my sense of humor. I think that even in the midst of all this pain and agony, it's good if we can joke around and you know, there's times to be serious and there's times to have fun. And I think that trying to make you all feel comfortable, and you know, I'm pretty down to earth. I'm pretty simple. I come from a teeny tiny town in Massachusetts, so humble beginnings, only about 9,000 people. And I think that that's just kind of stayed with me. You all know my wife, Dr. Lander, is also an OBGYN. She helps me do removals from time to time. But yeah, we're just going to keep on doing our thing. She does most of the deliveries now. I don't deliver babies anymore. So thanks for all the hearts. I'm going to give you guys a couple more minutes for questions. If I don't see anything, I'm going to turn it down so Jenny can stop working and then I don't have to pay her anymore. I had a DNC June 20th because of bleeding. Endometriosis was found. They can't find endometriosis on a DNC, so I don't think I don't understand that. Thanks. They keep telling me it's fat. What? They better not be telling you you're fat. I have patients all the time tell me their doctor won't operate on them because they're too fat. I mean, I get it. It's harder to operate on somebody that's bigger. But if you're in that much pain, your weight shouldn't be a problem. Can tying your tubes on without you being put to sleep? No. Not if you do laparoscopy, you have to be put to sleep. All the way from Canada, Jennifer, thank you very much. Partial hyst, gained 70 pounds in 6 months. I would consider seeing somebody that can help you probably balance your hormones, and I would consider seeing a nutritionist because I think it will make a difference. I'm losing my hair in clumps. I'm having serious migraines. I have seen that. I don't know if it's caused by it, but I can tell you in the hundreds of women that I've seen, I see migraines and hair loss all the time. And I think Penny Barrar from the eShare Problems main page has good pictures of her before and after, and it's pretty impressive. Thank you so much for doing this. How do you remove Jane or TLH? Yes, you can have hormonal kind of fluctuating after surgeries. I am in Austin, Texas. Dr. McCarris, I don't know what Dr. McCarris does. I've never met him personally. I've heard his name bantered around here and there. I'm sure you can find women online that have had McCarris do their surgery, and maybe they can help you. Is the nickel and issue enough to have a severe allergic reaction? Depends on how allergic you are. The recommendations currently before you put Essure in are to ask patients if they have a nickel allergy, and if they're uncertain, then you need to do nickel allergy testing. So if you're allergic to nickel and you have nickel in the Essure, yeah, you can have a severe allergic reaction. Yes, Norma, I would agree with you. I am awesome. Well, thank you, Misty. You're awesome. I had a partial hyst, remove Essure, I gained 70 pounds. I already saw that. Yes, 23-hour observation is what I do for hysterectomies. What can I do if I don't have insurance? The only thing I would consider, Karen, would be to look at a place called Care Credit or Parasail. They do loans for medical procedures. I take both of those. There's probably doctors in your area that take those. Will my hair grow back? Stephanie, that's impossible to say, but I would see a dermatologist as well. But I have seen hair grow back. My doctor won't tie my tubes awake. They shouldn't tie your tubes awake. It would hurt too much. It's impossible. I don't know anybody in Maryland, sorry. Can removal from abdomen be a cavity? Yes, done it many times. I understand that, Norma, but there's really no way for them to do a laparoscopic tubal with you awake. It's just not physically possible. Aaron, you know, the thing with the hysterectomy is you have to want to do it. If you don't feel comfortable doing a hysterectomy, then don't do it. I tell patients that all the time. I don't want to do surgery on somebody that doesn't want it. And I would say to you this: I don't want to take your uterus. That's not my job. I want you to give me your uterus. And I know that sounds corny, but in a way I think that helps you heal too. For you to mentally give it to me and I'm not taking it, I think that makes the healing a lot better. I think it's better for you mentally than this idea of me taking the uterus from you, which sounds horrifying. And if you feel that way, then let me take the Essure coils and the tubes, but I don't want to take your uterus. And so, Aaron, if you are worried about that, then I would definitely not have it removed. Had my removal 4 weeks ago, almost feeling one. Yeah, Christine, way to go. Christine's one of my patients. She's awesome. I was just curious. I have a lot of pain during intercourse and things. It's because my Essure. It definitely can be the Essure. If you think about it, a foreign body in your fallopian tubes that's next to your vagina, and the uterus and vagina are being moved during intercourse, it can certainly hurt. How long can you have menopausal symptoms after removal? 2.5 years would be, that's not normal. Ton of ibuprofen to relieve small part of the pain. Pain control is difficult because everybody's different, and we certainly don't want people to get addicted to pain medications. Usually reversals aren't covered by any insurance. Georgia, Ed Durone, D-O-U-R-R-O-N, Ed Durone. I think he's in Atlanta. I don't know. I don't deal with medical devices. Yes, you can get pregnant with Essure, even years after. It's always a possibility. Even if you have your tubes removed, there's probably a 1 in 1,000 chance of getting pregnant. Nothing is perfect except for hysterectomy. State insurance, you usually have to stay in your state. I wish I could be everywhere, but nobody wants to pay to fly me out there, and I can't get a license in all those states. But doctor said if Pap comes back normal in a few months, she will give me my removal. Wow, in a few months? Pap should take 1 week to come back. I had a laparoscopic tubal removed in August. I'm still bleeding. Is it normal? Pauline, you got to call your doctor. I can't really tell you about that. I don't know what they did. Oh, a 4-year-old. Keep tapping, 4-year-old. Tap faster. Does Dr. Pelosi do it? I don't know. What Dr. Pelosi does, but, you know. Anybody can do a hysterectomy. Any GYN can do a hysterectomy. But I would say there's probably that I know of, and this is just that I know of, probably 5 people in the United States that can do a proper coil and tube removal. And that would be Daron, Sills, me, Monteith, and maybe Aurora, but I don't know exactly what he does. Yeah, Michelle, that sounds about right, if that's exactly what's happening. Yeah, don't know that name, Crystal, sorry. The other thing you want to do is if you're having the coils and tubes removed, have the doctor draw you a picture. They can fudge around terms like, oh, I'm gently going to tease, I'm going to cut around, I'm going to do this. They can't fudge a picture. Make them draw you a picture of the uterus and the tubes and show you how they're going to get the coil and the tube out of the uterus every time. If they show any sort of cutting on the tube, cutting of the, at the junction of the tube and uterus, then go somewhere else. And again, my opinion. I will freely admit that's my opinion. Pauline, I don't know. I know that there's a lot of people like Angie and Angela and Angela. I think everybody in the admin is actually named Angela. Isn't that? Is that true? I don't know. Pregnancy in general, can you? Boy, Melissa, that's a big question. Yes, women can seize these even after pregnancy, depending on what the cause was. How long can you be off your feet with a hysterectomy? It depends on the type of hysterectomy, depends on how hard it was, depends on your job. 2 to 6 weeks. Do I know any doctors in St. Louis? No, sorry, I don't. Not yet. Keep pushing those hearts, little 4-year-old. I'm loving it. You got to push faster, though. You got to get dexterous on those hearts. No, it's interesting, Desiree, you're about the 5th person to ask me about Wisconsin, and sorry, but I don't know. If you had to recommend a birth control, what would you recommend? Well, when I talk to people, I don't do reversals. When I talk to people, I give them all the options, and then we discuss what sounds best for them. My doctor cut my tube from end to end. No. Well, that's the manufacturer says that's one way that you can do it. I don't do it that way, and I don't recommend you do it that way. I do my hormone check before surgery, and then occasionally I do it after surgery. I don't know anybody in Oklahoma that does just coil and tubes. I just talked to 2 women in Oklahoma today. I was just in Ardmore, Oklahoma on Monday and Tuesday of last week. I did my training at OU many years ago. But a lot of women from Oklahoma come down here just because it's so close. Man, I don't know what I'm going to do with all those hearts. I don't think I've ever gotten that many before. I usually get these deals. She asked if I was comfortable removing just the tubes, and I said as long as she said it was tricky. If she thinks it's tricky, she shouldn't do the removal. I have had a laparoscopic tubal doctor was unsuccessful, left 1 broken coil inside it. I told him, yep, and Valerie, that's exactly why I say what I say, because I see the fragmentation all the time. Yes, your hormones can definitely be wacky after coming off the pill. Yes, of course I'll remove yours, Stephanie. Call Jenny, 512-956-0596. No, 512-956-0296. And she can get you in and talk to you about how we do out-of-state people. Out-of-state folks, really, the way we do things now, you only need like 1 visit because I can do everything else face-to-face on the internet through a telemedicine visit. So. Which one do you do? IVs right now, reloading. It depends, Nash, on who's doing your removal, why they're doing the removal, and what procedure they're going to do. The number is 512-956-0296. Jenny, are you still on? If you're on, can you post the number? Maybe Jenny will post it. 512-956-0296. Jenny just joined. Jenny, can you post the office phone number for everybody? And you can also make online appointments. If you want to do a video appointment, you need to talk to Jenny because I only do those on Monday. Oh, 71. 71. We're there. If you want to do an office visit, I see patients on Mondays, Wednesdays, and Fridays. Yeah, a lot of people call it eHealth. There's the phone number. Thanks, Jenny. Thank you, Michelle. Michelle doesn't work for me, but she has the number. You're the best. Love watching your podcasts. Well, if you're looking to get it done, let's get this done. Let's get these things out in due time. She doesn't feel the need to check hormones because they don't know exactly what hormone levels should be anyway. That's ridiculous. They don't need to check hormones. I do it as kind of an added thing because what I've been finding is about 90% of the patients that come in are horribly imbalanced. Whether or not that's from the coils, who knows? But insurance pays for that usually. And the only reason doctors don't want to do hormones is because they just don't want to mess with them. Your doctor, Amy, if they're telling you all they can do is a hysterectomy, then yes, that's all they can do is a hysterectomy. And I would applaud them for being honest because that means they're not going to erroneously try to pull coils out when they don't know how to do it. You don't have to have a hysterectomy, but you need to have somebody that knows how to do the other procedure. Otherwise, if you can't travel and they're offering to do a hysterectomy, then that might be your best choice. Yes. Stephanie, it's always coded with your problem list, meaning your ICD-10 codes. We then give the insurance CPT codes, and they will, my office staff will get authorization for you, and then we call you, we tell you what you're going to owe. If there's a copay for the surgery, the hospital will call you and do the same. Insurance covers removal. I've maybe had one denied out of 400. You can have problems after a hysto. Just, in general, from having his hysterectomy in general, you can have complications afterwards. Do you see a lot of testosterone deficient women? Yeah, when you check hormones on each lady. Yep, I would probably say 80 to 90%. Oh my goodness, we're up to 87 people. Norma's on this stuff. Norma's gonna be my sidekick. She's gonna be my counter when we go on the road with this. Man, I'm up to 91. This is crazy. Where's my 4-year-old? The 4-year-old left. I have the coils and want them removed in the worst way. The doctor who implanted them refuses to remove them and says there's no way. My symptoms. Then you need to find another doctor, Brittany. Go to the eSure webpage for your state on Facebook. Ask one of the admins on the main page. Find somebody that will help you. There's got to be somebody that will help you. And if not, fly on out to Austin. You can come in October. Austin, we have ACL, big concert. Stay for a week. See the Red Hot Chili Peppers, Chance the Rapper. I mean, it's a pretty good lineup. Oh my goodness, we're up to 100. Crazy. Norma didn't even tell me we went over 100. Norma, you're losing it. Will tubes and coils be covered by insurance? Yes. Thank you for being on board with these ladies. Spencer Ruff, most doctors just tell you. Most doctors have told me that I'm crazy, so I understand what you're saying. Thank you, Brenda. Hope you're doing well. My doc recommended it after I get a hysterectomy done. Some people told me I should leave the... No, if you're going to get a hysterectomy done, take the tubes. You can leave the ovaries. That's a personal choice, whatever you want to do. Got my hormones under control. Well, I would only get the coils removed if you're having problems. Pain, bleeding. If the problems... You should only have surgery done if you're having pain and problems that are interfering with the way you want to live your life. Best way for testosterone deficient women to supplement? Julie, that's a hard question. There is no FDA-approved testosterone supplement for women, but there's about 12 for men. Isn't that crazy? Currently, you have to compound either a cream, a sublingual tablet, Some women are getting pellets. Pellets are horrifying. I don't recommend pellets. I hate pellets. I don't like them. I hate them. They're horrible. Did I mention that I don't like pellets? So that's just my opinion. All this is just my opinion, but I'm not a big fan of pellets. And if you're going to do testosterone replacement, I certainly wouldn't do pellets. I would look more at maybe a cream or a sublingual lozenge or something like that. Thanks, Norma. Norma's on it still. Anybody else? This is good because when I get off, my wife's going to want me to go for a walk because she wants me to move my body. And it's about 104 degrees out, and I don't want to go. So the more that you guys can keep me on here, the better. Should a camera be used in assisting? Yes, I do that all the time. I use the DaVinci. An extreme inflammation good enough for a reason? Well, it depends on, everybody's different, Amber. And if you feel that if you want to go through with the surgery because of that, I wouldn't deny you that because I have seen inflammatory diseases getting better. Yeah, bloating is very common. Weight's a factor because you have more complications with the bigger a patient is. But I don't do that. I will operate. I mean, I think the biggest woman I've had so far is 360 pounds. But, obviously if you're 600 pounds, it might be different. But yeah, I wouldn't say it's a problem unless you're really, really big. Yeah, robotic surgery. If your doctor wants to do robotic, then do robotic. I'm a fan of robotic surgery. I think it does allow you to do a lot more. I do think if it's a doctor that's very experienced with robotic surgery, it can be a wonderful thing. So I wouldn't be afraid of the robot. Again, how many have they done, and are they comfortable doing it? And if they are, and you're comfortable with them, then I would do it. Anytime. Obviously, the disclaimer, I can't give out medical advice. This is all just my opinion. And I would always recommend that you talk to your personal physician. Unless, of course, I am your personal physician. Then you can talk to me directly. No problem, Tanya. My pleasure. Yeah, hysterectomy, it might take a while to get your hormones back into place. And hormone balance depends on a lot of things. Weight, nutrition status, genetics, how old you are. There's a lot of things that go into that. So I would definitely give it some time. I am not in Chicago. I am in Austin. After the Essure, yes, I've seen not a lot. I would say probably less than 5%, but whether or not that was caused by the Essure, I mean, we won't know for sure. But I have seen women that have thyroid problems, especially things like Hashimoto's, which is an inflammatory disease, so an autoimmune disease. So that could be part of it. We just don't really know. What time is it? Does anybody know the time? Because when you do one of these things, it takes the time off of your phone. Do I perform NovaSure? Would I? Would I? Yes. Do I? No. I can't remember the last time I did one. Probably a year and a half, 2 years ago. Would I do one with the right patient? Yes. I don't think that it's a horrible procedure, but just like anything else, if you do too many of them and you're doing them on everybody, probably not a great thing to do. But I do them. About you, the Essure place ended up with a 7-pound tumor. Probably not, Stephanie, but I don't know for sure. But it doesn't sound like that's probably something that would have possibly happened. Tumors can happen for different reasons, not necessarily related to anything in general. Thanks, Tanya. Can we have my info? Jenny, are you on? Can you put the info up? Office phone number, 522. Yep. See, Amy says robotic surgery, she was back to work quick. And that's what I'm talking about. That it can happen very quickly. You can go back to work, but not everybody. You know, some women can though. You're welcome, Glenda. That's your FSH of 63. No, Kim. Well, again, I don't know. Let me just say that. An FSH that high usually indicates menopause, but whether or not that's caused from Esher, I don't know if anybody could tell you that with any sort of certainty. Well, Jennifer, that depends on a lot of things. I mean, you're talking estrogen, progesterone, testosterone, and then not what's normal, but what's normal for you. I mean, what makes you feel better? Is it a 1 or a 2 or a 3? Everybody feels different at different levels. So you not only go on the results, you go on the symptoms. Well, your period can stop for a lot of reasons, Sienna. Stress, polycystic ovarian syndrome. It doesn't necessarily mean it's a bad thing. You should probably go see somebody. Is it hard to have a baby? I would call Dr. Monteith in North Carolina and ask him that question. Can you have it removed even if they... Yes. Milagros, but I would say I wouldn't do surgery unless you needed it. Yeah, that's good. It's always good to get informed, right? I mean, whether or not you want it really depends on how much information you can get. And I know there's a lot of women out there, and you don't talk to them because they're not on the Esher Problems page. But there's a lot of women out there that have Esher that don't have any problems. So again, the point of this, the point that I would want my colleagues to understand is that there is a subset of women that have problems with Esher, and we're just not recognizing it. We need to help them. I don't know the answer to that, Brittany. That's a good question. I've never been asked that before. Yeah, Norma, I think if somebody tells you you're too fat, then you probably ought to go somewhere else. Although my doctor did tell me that I needed to lose weight 6 weeks ago. So I'm not leaving him because I probably did. And that's why I lost 17 pounds. And part of it was just because it's a challenge. It's like, you know what? You're going to tell me I need to do this? Fine. I'll do it. And I'm going to show you. So don't tell me I'm fat. But he did. So if you know if you need to lose weight. But, you know, if it's going to take you 2 years to lose 60 pounds, well, you shouldn't have to suffer for 2 years. You know, I just think that's ridiculous. Yes, if robotic can be done and somebody's willing to do it, Carmen, then you might want to consider having that done. What else, folks? I see is that my 4-year-old back pushing the hearts? Because you were falling down on your duties there for a while. Periods can stop all the time, Sienna, for a multitude of things. Stress, you know, diet. I mean, it can change a lot of that's a tough one to answer. So I wouldn't be able to answer that question unless you had a bunch of testing done. And if it's only one period, that's probably not a big deal. You know, if you start missing periods for 3 to 4 months, obviously the biggest reason to miss a period would be pregnancy, especially if you're in that age group. So, you know, you might want to get a pregnancy test. What else? What else we got? Yes, rapid fire, 4-year-old. Go, 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 go on the hearts. If your doctor hasn't done a test and you're scheduled for removal, Ashley, then you either have somebody that doesn't know what they're doing, you have someone that doesn't respect the coils, or you need to, you know, maybe get a second opinion, but you should ask for that imaging. And if they say no, then I would have a problem with that. But that's just me. I'm having a hysterectomy and self-injectomy. What is the best method of performing surgery? It just depends. The best method, Heather, is whatever method that doctor is comfortable with. chances of getting pregnant, Lorraine, I would quote somebody as about 1 in 1,000. That would, I mean, if it's removed, if you have a reversal and you want to get pregnant, then those numbers are a lot higher, obviously. And I would call somebody like Charles Monteith in North Carolina and ask him what his success rates are. I think I've seen him quote something around 30 to 35% chance. So, all right, well, it's getting close. Any last requests before we log off? Again, none of this is set in stone. None of this is medical advice. This is just me giving you my opinions, maybe trying to steer you to the right people. I usually get my x-rays as long as they're within a year. I'm usually fine with that. I don't know. Is that John Einarsson that's doing it? You're welcome, you're welcome, you're welcome. Ah, now I have to go on my walk. You're right. Maybe she'll let me wait for it to get a little bit cooler out. I am in Austin, Texas. Yes, John Einarsson. Well, Einarsson's the head of the president of the American Association of Gynecologic Laparoscopists, so I assume he knows what he's doing. So I would, if you feel comfortable with him. Yeah, I know. She's going to make me walk. I probably need to walk, though. So, let's see. Just the last thing that I want to say is just you need to feel comfortable with the information that you're getting. If you don't feel like you're being listened to, if you don't feel like you're getting the answers that you want, then go somewhere else. You should never, there are going to be people that do that. There are going to be people that talk to you that way. There's going to be people that do that sound that way, because you could meet 10 people at a party and not like 3 of them. And doctors are going to be the same way. Sometimes, it's just personality conflicts, but you should always feel comfortable. And if you feel comfortable, then that's a good thing, and I would stay with that person. Holistic gynecology nationwide. I mean, there are some. Yeah, there's doctors around that do that kind of thing. Doctor in Chicago, not currently. Sorry. I'm sure, again, there's probably an eSure page for Illinois that you can go to and get some recommendations. All right, guys, I think I'm going to wrap it up. I hate to hang up on 90 people, but if I go too long, then nobody's ever going to want to watch this again. So this will be posted to YouTube on my YouTube channel. If you need to call the office for an appointment, it's 512-956-0596. And if you want to post questions afterwards on here, please feel free. I would also love it if you could share this post to any of the eSure pages, eSure Problems, the main page, any of the other pages that are up would be great, because the more people that watch this, the better. More information we can share, the better. And I would encourage y'all to join your local chapters online so that you can get the information of doctors in your area. Kim's here. If y'all haven't met Kim, she's my medical assistant extraordinaire. Although she was working today, but she was working outside because she was watching the eclipse. So that's how relaxed I am as a boss. But let's just keep the communication open. Let's keep talking, keep sharing information about eSure, about hormone replacement, hormone balance, fibroids, whatever you want to talk about. Let's just bring it up. And thank you for all the hearts, and I really appreciate it. And you can check out the YouTube channel that just got posted, where you can watch any of my videos. There's probably about 15 of them up now. This is the 4th or 5th Q&A channel or post that I've had on eSure removal. So again, thank you for all the hearts. It's lovely, and I'll see you guys around the internet and maybe in the office.